Now with today's checklist and some help to stay healthy as we age.
Are you eating a biscuit? You're actually eating a biscuit.
I was eating a biscuit. It's going to help me as we age. And I was going to finish the biscuit, but I lost track of time. There are lots of new tools, technologies, and advice geared toward helping us live longer. But what's really worth focusing on? Here to break it all down, NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, I apologize for my biscuit eating. I know that's probably not on the diet that you would advise. But let's talk about tests and screenings, Dr. Gupta. Where should we start? Because, I mean, by the way, blood tests for colorectal cancer now, it's fairly new.
Yeah, it is new. Here's the thing. Most people don't wake up in the morning wanting to get a colonoscopy.
No.
Or thinking about the prep. That's the big problem here. And so, blood tests for colorectal cancer, this actually got approved by the FDA back in early 2024. Right. And it's offering this exciting new horizon where you can get a blood test if you're 45, if you don't have a family history, 45 and older, no family history, something to talk about with your doc. Instead of potentially getting a colonoscopy, here's why it matters. Most people are not getting colonoscopies when they should, so this is a good pre-screen. Other blood tests for other cancers, there's other tests now, things for like kidney cancer, things that we don't have an actual screening tool for, like a mammogram for breast cancer. There's other tests now online that cost a few $100, and your insurance may or may not cover it, but it's an important conversation to have with your medical provider. Is this something that might be good for you? And full-body MRIs.
I want to ask about this because I've got some buddies who either have done it or are in the process of doing it. What's your recommendation on the full-body MRI?
I'd say if you don't have a family history of a genetic disorder or a genetic predisposition to cancer, don't do it.
Why?
And here's the reason. It just leads to unnecessary testing. We have no evidence that these things, which cost a lot of money, actually improve outcomes. They may predispose you to get a bunch of tests and biopsies, and that's the reason why we say don't do it unless there's a reason to do it.
Okay. Dylan's standing by.
All right, let's talk about technology. We've all got smartwatches or, just trackers of some kind. What are the numbers we should actually be looking at with those trackers?
Yeah, Dylan, I'm glad you asked. Sleep tracking, this has gotten really good, whether it's on a ring, whether it's on your wrist. It can actually tell you, are you getting good sleep? How long are you sleeping for? It's helpful information. Here's what I really like, VO2 max. This is basically, when we think about our engine for fitness, it's our heart and our lungs. As you're getting better, as you're conditioning better, your heart and lungs can do more. You can go from a 9-minute mile to an 8-minute mile. VO2 max, that's what actually tracks that. How conditioned are you? So you're seeing this pop up a lot more. Step count progress. Hey, doc, I should be doing 10,000 steps every single day. There's actually no evidence behind that, Dylan. It could be as much as little as 4,000 if you're older and just starting. Really, it's an individualized goal. It doesn't have to be 10,000. 4,000 to start and just continually improving. Heart rate trends, really critical here. We want that to be 120 to 140 with just baseline walking.
Okay.
About 180 if you're physically fit. But you want to trend that out. If your heart rate trends 60 to 70, that's where we want it to be. If it's higher, something might be happening.
All right, to get our heart rate up, obviously exercise is important, but
that's right.
What exercises for what age?
So I think you're going to demo this for us.
I guess so.
And so we're going to do a compound exercise. Dylan, thank you for being willing to demonstrate this. I'm going to hand these to you.
There we go.
So we're talking about compound exercises. As we all age, you want your core to be tight.
Okay.
And then you want to actually just lift this, a dumbbell push above your shoulders and just back down. Yeah, there you go. Perfect.
Thank you.
That's actually,
yep.
And your strength, you're keeping your core tight. We're going to go for 10 if we have time.
Okay.
And what's happening here is you're working your core, you're keeping it tight, and then you're also working your delts, you're working your back.
You do feel this working all over.
That's a very good form. And so that's what we want. Multiple muscle groups actually being exercised at the same exact time.
And I didn't fall over.
And you didn't fall
good
over.
For balance.
That was excellent.
Okay.
That was excellent.
Doc, what about brain health? Oh, I brought these for you, Craig, while you had a little something. Okay, what about brain health?
Thank you.
Brain health, yeah. What we're seeing here, brain health-wise, is, how many times, Al, do you and I talk about leafy veggies? Turns out there's some good stuff in there for brain, for cognition, vitamin K, lutein. So you want to make sure that these things...
Lutein, not Wu-Tang.
That's right. That's right. Not Wu-Tang, lutein. Fatty fish, omega-3 fatty acids, actually are linked to lower levels of beta amyloid, things that build up in Alzheimer's. So you want to make sure you get your tuna, your salmon, berries, flavonoids, actually help with memory. Staying social, really, really critical. Connectivity actually lowers the risk of dementias. Multiple studies have shown that. And aim for 7 hours of sleep. We know that poor sleep actually hastens aging.
Okay.
Not a secret to longevity, biscuits and jam.
There you go. We left that one out.
But they're so good.
Thank you.
It's
So
good for
good.
happiness.
There you go. Thank you, Dr. Gupta.
Thank you.